Hi everyone, my name is Maylee Chatwin. Today we're going to be diving in about the topic that affects all of us, why universal healthcare matters. Imagine a world where you have to choose between paying rent or going to see a doctor. Universal healthcare makes that possible. It's about creating a system where everyone, no matter their background or their income, can get the care that they need. Okay, in a scenario, let's say that you wake up sick with something super serious and you need to see a doctor. And the doctor visit will cost $300 cash out of pocket. What will you do? Option A, do you go anyway and figure out the money later? Option B, do you wait it out and hope your sickness gets better? Or C, search online for home remedies or advice instead of going? A lot of people are forced into this kind of decision every day, and it's a big reason why universal healthcare is such an important issue to talk about. In our presentation today, we are going to be going over what universal healthcare is and why it matters, the health equity and removing financial barriers, reducing care gaps across social groups, the economic benefits of universal access, and the key to takeaways and why it matters to all of us.
When we talk about universal healthcare, we often focus on the human side, making sure everyone has access to the care they need. But what's equally important is the economic side, because universal healthcare actually saves money and boosts productivity across society. First, it reduces overall healthcare costs. When people have access to preventative care, they're more likely to catch health issues early before they become serious and expensive to treat. It's far cheaper to manage something like high blood pressure with routine checkups than it is to pay for an emergency hospital visit down the line. Second, it leads to a healthier, more productive workforce. When people can afford to take care of their health, they miss fewer days of work and can contribute more consistently. That's especially important for businesses, which lose billions each year to illness related absences. A healthier workforce helps the economy run more smoothly. Third, universal systems, especially single payer models, have much lower administrative costs. In the US, a huge portion of healthcare spending goes to insurance paperwork, billing departments, and complex approval processes. Countries like Canada and the UK, which have universal healthcare, spend significantly less on administration, freeing up more money for actual patient care. And speaking of those countries, Canada and the UK both spend less per person on healthcare than the US, yet achieve similar or better health outcomes. That's proof that universal healthcare can be both cost effective and high quality. So while universal healthcare is clearly the right thing to do for public health, it also just makes smart economic sense.
Without universal health care, we have unequal access to health care, and millions of people around the country don't get the care they need, not because they don't want it, but simply because they can't afford it or they don't have easy access to it. And these issues are most common in Black, Hispanic, rural, and low income communities where they don't have that easy access, and over 30 million people in the US are uninsured. So we can level the playing field by universal access to healthcare. This will remove the stress of trying to afford and access healthcare. Universal healthcare promotes equity. It removes that barrier so people can focus on healing on rather how they are going to afford it. And they can not have to stress about paying for a doctor's visit or medication. We can create a healthier future through universal access to healthcare. It shouldn't depend on your background, and that shouldn't hold you back from getting the treatment you need. Universal healthcare gives every person the opportunity to live a healthier and more secure life and lifestyle.
To conclude, universal access to healthcare is not just a moral imperative, but a practical solution to many of the challenges that we face today. By ensuring that everyone receives necessary medical services, we promote health equity, reduce healthcare costs, and improve national productivity. Universal healthcare also plays a vital role in reducing health disparities, giving everyone a fair chance at care and fostering economic growth. Countries with universal systems, such as Canada and the UK, have shown that better health outcomes and lower costs are achievable. For instance, Canada's single-payer system has significantly lower administrative costs compared to the US, allowing more funds to be directed towards patient care. In the UK, the National Health Service, also known as NHS, provides comprehensive care to all residents, resulting in better overall health metrics and higher public satisfaction. Universal healthcare can transform lives by removing the financial stress associated with medical expenses. Imagine a world where no one has to choose between paying for healthcare and other essential needs. This would lead to a healthier, more productive population, as people can focus on their well-being without the burden of medical debt. Preventive care is another crucial aspect of universal healthcare. By providing regular checkups, vaccinations, and early treatment, we can prevent illnesses from escalating, reducing the need for costly emergency room visits. This not only saves money, but also ensures that people lead healthier lives. For example, regular screenings for conditions like diabetes and hypertension can catch these issues early, preventing complications and reducing long-term healthcare costs. Universal healthcare also strengthens social cohesion and public trust. When everyone has access to the same level of care, it fosters a sense of community and equality. People are more likely to support and trust a system that treats everyone fairly, leading to a more harmonious society. This sense of fairness and shared responsibility can enhance social stability and reduce tensions related to healthcare inequalities. Finally, as Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." This quote underscores the importance of striving for a healthcare system that serves everyone equally. By advocating for universal healthcare, we can work toward the future where health equity is a reality and everyone has the opportunity to live a healthy life. Thank you for your attention. We hope that this presentation has highlighted the importance of universal access to healthcare and inspired you to consider its benefits for our society. Let us take action and support initiatives that aim to provide healthcare for all, ensuring a brighter, healthier future for the generations to come. Together, we can build a system that prioritizes health and well-being for everyone, regardless of their background or circumstances. Now is the time to advocate for policies that promote universal healthcare. Engage with your local representatives, support organizations working towards health equity, and educate others about the benefits of universal healthcare systems. By working together, we can create a society where everyone has access to the care that they need, leading to a healthier, more prosperous world for all.